Mental health, or brain health as I like to refer to it, impacts every one of us. I'm a social worker myself and have seen the toll this pandemic has taken on members of my own family, including myself, including my husband, who's a high school teacher locally. Mental health is not only about serious mental illness or significant trauma. It's about the day-to-day stress and anxiety that accumulates over time and takes a toll on our ability to effectively parent, to work, to be fully present for ourselves and our loved ones. As my favorite book on this subject says, the body keeps the score.
So today is a great day, Norwalk. I want to talk to you this morning. Today is about you, today is about us, today is about community. And I believe, as Nicole has said, you are not alone. Today, your city is concerned about your well-being, how are you doing, and how you're faring. We all have been impacted in many different ways. And I'm so excited that the mayor and I were both joined with your community, the providers, the folks that we're asking you to call upon if you need help.
We just wrapped up a community survey here in Norwalk, so I want to share with you some sobering statistics. Norwalkers reported that COVID has had the worst impact on their mental health compared to anything else, including their financial, their employment status, their physical health, their relationships. Our survey built in a screening tool, the PHQ-4 for the clinicians among us, and it found that 62% of our survey respondents were experiencing psychological distress. 62%, way more than half. That included 29% who are having moderate to severe symptoms. The treatment agencies know how much distress is out there. Everyone's getting swamped with referrals, but there are a lot of people out there who are not being seen or heard. 40% of our Norwalk parents reported that they were concerned about depression in their children. 18% of adults responding to our survey said they had been using alcohol more during the pandemic. We previously did focus groups with youth, and youth were telling us, in general, the good news is in general, youth have less access to substances and are probably using less during the pandemic. However, there is a population that has been getting on Zoom and getting drunk with their friends, and that's how they've been socializing. And to a level that's incredibly concerning. Talked to a mom, daughter drank about a whole bottle of vodka, almost was hospitalized. And kids are also telling us that they've been using marijuana sometimes on a daily basis to cope with the stress of the pandemic. Often they're doing that through vaping marijuana. So here's a little plug from the substance use prevention side. If you don't know, when you're vaping marijuana, you are getting the drug. If you're doing, like you're dabbing wax, you're talking about a drug that is almost pure THC, 80, 90%. This is something that is we are finding at Norwalk Hospital, kids coming in with psychosis, all kinds of really distressing symptoms. And I mention that in part because during Mental Health Awareness Month, we also have National Prevention Week. I'll talk more about that in a minute. Finally, 22% of respondents in our survey said that they had worse access to mental health services. So much more need, worse access. But access is through teletherapy right now. So that removes some barriers. Access is also, if you call an agency and they can't see you, maybe someone else can. Can all the treatment providers please raise your hand? Hold up your sign. Some of you brought a sign. We're here to help. Okay, so these statistics show why it's so important for us to have open conversations about mental health. There is no shame in saying that you're anxious, that you're depressed. Literally, more than half of us are right now.
It's awareness, it's knowing how to approach somebody that you may suspect is having difficulty. It can manifest itself in something as minor as sleeplessness. That could be a part of stress. It could be increased level of anxiety. It could be increased depression or chronic depression, increased substance use. There's so many different ways that this manifests itself that there's no one magic umbrella that you can identify. So just be aware of your surroundings, be aware of the people you know, be aware of the people in your family, your friends, relatives, so that when the time arises, you'll be prepared to help them. And when you help them, you're helping yourself, because that's really what we're all about. We are all human beings, and we have social and emotional needs. And when our social was dragged away from us, ripped out from under us suddenly last March, we didn't know how to respond to it. At first, it was just very confusing, and then it just got very, very frustrating, and everybody had trouble dealing with it. It's important that we recognize Mental Health Awareness Month, because awareness and tools that you can use, that's going to help you do what we need to do to help other people. So Mental Health Awareness Month, May 2021, whereas Mental Health Awareness Month has been observed in the United States annually since 1949. Whereas each year millions of people face the reality of living with a mental illness, and our culture, beliefs, sexual identity, values, race, and language all affect how we perceive and experience mental health conditions. Whereas mental health conditions do not discriminate based on race, color, gender, or identity, anyone can experience the challenges of mental health illness regardless of background. And whereas 1 in 5 adults and 1 in 6 youth across the country experience a mental health condition every year, and whereas recent survey data shows COVID-19 has had a negative impact on Norwalkers' emotional well-being, and residents report less access to health care and mental health supports. And whereas we share the importance of care in our relationships to others in mental health treatment and services and in support and education to millions of people, families, caregivers, and loved ones affected by mental illness. And whereas together we can realize our shared vision of a nation where anyone affected by mental illness can get the appropriate support and quality of care to live healthy, fulfilling lives. A nation where no one feels alone in their struggle. Now therefore, I, Harry W. Rilling, Mayor of the City of Norwalk, Connecticut, do hereby proclaim the month of May 2021 as Mental Health Awareness Month in Norwalk, and in doing so, encourage residents to join us in raising awareness about mental health, fighting stigma, providing support and education, and advocating for policies that support people with mental illness and their families. In witness whereof, I've set my hand and caused the seal of the City of Norwalk, Connecticut, to be affixed on this 30th day of April 2021. Thank you.